Hey everyone, welcome to our deep dive on perioperative nursing. We're about to jump into the crucial role nurses play before, during, and after surgery.
The entire perioperative journey.
Yeah, you might think, okay, perioperative nursing, that's the OR, right?
Right.
But it's a lot more than that.
It is. It really is. It's a whole journey that starts before they even get to the OR,
Yeah.
and it continues well after they leave.
Exactly. So we're going to unpack this journey and give you a good understanding of what perioperative nursing really entails. The assessments, the interventions, even the potential hiccups along the way.
Yeah.
We'll be focusing on patient safety and well-being every step of the way.
Very good point. Very, very important.
Because that's what matters most, right?
Absolutely. Absolutely. One of the things that's really helpful is thinking about perioperative nursing through a patient-focused model. It's a very holistic approach.
Okay.
So think about it as a framework with 4 different domains, 4 different areas.
A framework.
Yeah.
Yeah.
So first and foremost, you have safety. That's the bedrock, the foundation.
Right. Makes sense. Makes sense. The surgery is a very vulnerable time for a patient.
Absolutely.
So safety is definitely top priority. What else? What else do we need to consider?
Well, also, the physiological responses. Surgery is a stressor to the body, no matter how minor or how major.
Okay.
So, we need to think about how it impacts the respiratory system, fluid balance, even the endocrine system.
So not just looking at the surgical site itself.
You got it.
We're looking at the whole body.
The whole body, how the whole body responds.
Okay. What about their emotional state?
Yes. Behavioral responses. So patients react to surgery in a lot of different ways. Some people are anxious, some people are fearful, and some people might be a little bit excited about it.
Right.
It's a major life event.
Yeah.
We have to recognize and address these emotions.
Absolutely. Because surgery isn't just a physical thing, it's an emotional event, right? So it's like we have all these different wheels turning and we have to kind of keep an eye on each one.
You got it.
To make sure everything's working properly.
Yeah. So speaking of keeping things running smoothly, the 4th domain is the health system.
Okay.
That's the supporting structure.
Right.
So policies and procedures, availability of resources, equipment.
So it's like a well-oiled machine where every part has to work together.
Absolutely.
To get the patient through this journey.
And perioperative nurses are real collaborators in this whole thing.
Right.
We work with the surgeons, we work with anesthesia providers, we work with other nurses, even support staff. It's a whole team.
Yeah, it's a huge team effort.
Absolutely.
Okay, so now we've got this big picture, right? Let's zoom in on the first stage, the preoperative phase.
Okay.
I imagine assessment is super important here. We're laying the groundwork.
You nailed it. It's all about getting a complete picture of the patient's health, their medical history, their surgical history, any medications they're taking. It helps us figure out if there are any potential risks, and then we can tailor our care to their individual needs. Like, just think about age.
Okay, age, sure.
Infants, for example, they have such tiny blood volume, Even a little bit of blood loss can be a big deal for them.
Wow, yeah. I never really thought of it that way. It's a whole other level of thinking. What about older patients?
Right. Older adults, well, they might have some age-related changes that could affect how their body responds to anesthesia and their recovery. They might have, weaker lungs, or their heart might not be as strong. So we have to be very careful.
So age is a big one, but I'm sure there's other red flags.
Oh, absolutely. Like if someone has kidney disease or liver problems, diabetes, or if they've had complications during surgery before, we have to be detectives.
Be really thorough.
Absolutely. Gather all the information.
Okay, so we've done our assessment. We've got a good understanding of the patient's situation. What's next on the pre-op checklist?
Preoperative teaching. That's huge because we want to empower the patient by answering their questions, giving them information, preparing them for what's to come.
Makes sense. I bet a lot of patients are really nervous about surgery.
Oh, absolutely. And, they have a million questions. They're like, will it hurt? What's it going to feel like when I wake up? How long will it take to recover? All these anxieties.
Yeah, of course.
And it's our job to answer them honestly. We don't want to sugarcoat anything. We want to build trust.
That's it. Clear, compassionate communication.
That's it.
I love it.
And then we also teach them some practical skills that'll help them recover, like deep breathing exercises.
Oh, right.
And coughing techniques, especially if they're having chest or abdominal surgery.
Right.
That helps to prevent complications.
Prevent pneumonia and all that.
You got it.
Yeah.
And we talk about pain management
guy.
Everybody's pain plan's different. We want them to know their options.
Make them feel involved. Okay, let's fast forward to the big day, surgery day.
Right.
What are those last-minute things we have to take care of?
It's all about the checklist, the final checklist. It might seem routine, but those details, they're crucial. One of the big ones is NPO status.
NPO status. Remind me what that is again?
Nothing by mouth for a certain period of time before surgery. That means no food, no drinks. It seems simple, but it can prevent a very dangerous complication called aspiration.
Oh, right, aspiration. That's like when food or fluid goes into the lungs during surgery.
Exactly. And that can be life-threatening.
Definitely don't want that.
No, we don't. We also do a very thorough medication reconciliation.
Okay.
We have to document and review all of the patient's medications, making sure that there aren't any potential interactions,
Yeah.
making sure everything's safe. And of course, we can't forget about prepping the surgical site itself.
Right, of course. What does that involve?
It's all about minimizing infection. We follow very strict protocols for cleaning the skin. Sometimes we use antiseptic solutions.
Okay.
We might need to ask the patient to remove makeup, lotions, even deodorant, depending on the type of surgery.
Wow, even deodorant. I never thought of that. So many little details to keep everything sterile.
That's right.
Okay, so now we've prepped the patient. We're ready to head into the OR. What exactly is the nurse's role during the actual surgery, the intraoperative phase?
Now things get really exciting.
I bet.
We wear many different hats in the OR, each with its own set of responsibilities. For example, you have the scrub nurse, who assists the surgeon directly, hands them the instruments, make sure everything stays sterile. Then you have the circulating nurse, who advocates for the patient and oversees the entire OR environment, making sure everything runs smoothly and safely.
So there's a lot of coordination going on.
A lot.
Like a carefully choreographed dance.
It is. And maintaining sterility is the most important thing. Any little slip-up can put the patient at risk for a serious infection. We also have to make sure they're positioned correctly on the operating table. We use special equipment to prevent pressure injuries. And of course, we monitor their vital signs, their fluid balance, everything. We're always watching for any changes that might need our attention.
That sounds pretty intense.
It is.
What was it like for you the first time you stepped into the OR?
I was so nervous.
I bet.
I didn't want to touch the wrong thing or bump into something sterile, but the more experienced nurses, they were great mentors. They helped me learn the ropes.
So that mentorship, that's really important in this kind of specialized area. Okay, so we've gotten through pre-op, we've gotten through intraop, now we're in the recovery room. What are the immediate priorities in the postoperative phase?
Now it's all about helping the patient recover and preventing any complications. We start with frequent assessments, like every 10 to 15 minutes at first. We're looking for any signs of trouble.
Signs of trouble? Like what?
Things like shock, breathing problems, changes in their level of consciousness, any bleeding, and pain management is super important. We have to find the right balance, Enough pain relief so they're comfortable, but not so much medication that it causes other problems.
Yeah, pain can really hinder recovery.
Oh, absolutely. It can delay healing, make it hard to move around, and we have to watch for side effects from the pain meds too. Like some medications can slow down breathing or make people constipated, and we also keep a close eye on fluid balance, making sure the patient isn't dehydrated, but also not overloading them with fluids.
Okay, a lot to juggle in those first few hours after surgery.
It is. But that's what we're here for.
Okay, now what about those common postoperative complications? The things we need to watch out for?
So respiratory complications, those are high on our list. Like atelectasis. That's when the tiny air sacs in the lungs collapse.
Right.
And that's why those deep breathing and coughing exercises are so important.
Right. So we're back to that pre-op teaching. It all comes full circle.
Exactly. It lays the foundation for a smooth recovery. We can also use an incentive spirometer. That's a little device that helps them take deep breaths and open up their lungs. Now, another big one is deep vein thrombosis, DVT.
Oh, those blood clots.
Yes, those blood clots. They can be really dangerous, so we try to get the patients up and moving as soon as it's safe. We want to get that circulation going.
Okay, ambulation is key.
Absolutely. But sometimes it's not that easy for them to get up and move around.
Right, especially if they're in pain or they're weak.
Right, so we have to be flexible. We might start with some simple exercises they can do in bed, like ankle pumps or leg lifts. And as they get stronger, we can gradually increase their activity.
So we're meeting them where they are.
You got it. And cheering them on every step of the way. We also pay close attention to the surgical site itself. We're looking for any signs of infection, redness, swelling, drainage, the classic signs. And hand hygiene is so important here.
Always.
We also use aseptic technique when we're changing their dressings. Sterile gloves, sterile instruments.
Gotcha. Okay, so hand hygiene, aseptic technique.
Our dynamic duo.
Yes.
And of course, we can't forget about, those other important functions, like going to the bathroom.
Right, of course.
Surgery can really mess with their normal bowel and bladder function, so we're always monitoring their urine output and listening for bowel sounds.
To make sure things are moving along.
Exactly.
And what if they're not?
Well, then we have a whole arsenal of interventions. Like
Yeah.
if their bladder isn't emptying properly, we might use a bladder scanner to see how much urine is in there. And if it's full, we might need to catheterize them. And for constipation, we can encourage them to drink lots of fluids, eat high-fiber foods. Sometimes we'll even give them stool softeners. It all depends on the individual patient.
It sounds like nurses are the eyes and ears of the postoperative team. Always watching, always assessing, always ready to jump in and help.
We are. And clear communication is so important throughout this whole process.
Right. Communication keeps coming up.
It's the foundation of good care.
Okay, well, we've covered a lot of ground in this first part of our deep dive, from pre-op assessments to the hustle and bustle of the OR, and now into this crucial postoperative period. It's clear that perioperative nursing is a very dynamic, demanding specialty.
It is. But it's also incredibly rewarding.
I can imagine.
Seeing a patient progress from that vulnerable state after surgery to walking out the door ready to resume their life, it's an amazing feeling.
That's wonderful.
Absolutely.
Well, we're just getting started. For all our listeners out there who are eager to learn more, stick around for part 2 of our deep dive. We're going to keep exploring these essential concepts and unpack even more of those nursing pearls of wisdom.
I'm excited.
Me too.
Welcome back to our deep dive into perioperative nursing.
We've covered a lot of ground already, but there's still so much more to explore in this specialty.
It's true. It feels like we've only just scratched the surface.
Yeah. So we've laid the foundation, and now we're ready to build on it. Let's dive a little deeper into those surgical procedures.
Okay, sounds good.
Now, we know surgery is a big deal, but not all surgeries are the same, are they?
Right.
Some are pretty quick and straightforward, and then others are much more complex and involved. So how do we categorize these different procedures?
Well, one way is to think about the level of risk to the patient. We often talk about minor surgeries versus major surgeries.
Okay, minor versus major. That seems pretty clear-cut. What are some examples of those minor surgeries?
Think about procedures that are typically done in an outpatient setting, like a doctor's office or a same-day surgery center. They carry a lower risk of complications and usually don't require a hospital stay. Things like biopsies, cataract removals, maybe even a hernia repair would fall into this category.
Okay, so minor surgeries, those are like the quick in and out procedures.
Yeah, pretty much.
Got it.
Right.
Okay, so what about the major ones? What makes them major?
Major surgeries, those are the more complex procedures that often involve major organs, or they might be addressing a life-threatening situation. These usually require hospitalization and carry a higher risk of complications. So things like organ transplants, open heart surgery, or a major joint replacement, those would be considered major surgeries.
Okay, so the level of risk really helps determine the setting and the overall complexity of care. Are there other ways to classify surgeries, though?
Oh, absolutely. We can also categorize them based on their purpose. For example, a diagnostic surgery. That's a surgery that's performed to figure out what's going on, to get more information, like the laparoscopy to investigate abdominal pain.
Oh, okay. So it's like a fact-finding mission for the surgeon.
Exactly. And then we have curative surgeries. Those are aimed at fixing a problem, like removing a cancerous tumor.
Okay, makes sense. So diagnostic surgery is figuring out the problem.
Oh, right.
And then curative surgery swoops in and tries to fix it.
You got it. But sometimes you need to take action before a problem develops. That's where preventative surgeries come in.
Preventative. So you're trying to stop something bad from happening down the road.
Exactly. Like a classic example would be removing a mole that has a high chance of becoming cancerous. Then we have ablative surgeries. That's when you remove a diseased body part, like an appendectomy.
Okay, so we've got diagnostic, curative, preventative, ablative. Are there any other types we should be aware of?
Oh yeah, a few more. We've got palliative surgeries. Those are done to relieve symptoms, but they don't necessarily cure the underlying disease.
So it's about improving quality of life, even if you can't completely get rid of the problem.
Exactly. And then there are reconstructive surgeries, which are performed to restore function or appearance.
Okay, like repairing a cleft palate or doing breast reconstruction after a mastectomy.
Those are great examples. And then finally, there's transplant surgeries, where a diseased organ is replaced with a healthy one from a donor.
It's really amazing what we can accomplish with surgery these days. We've talked about all these different types of surgeries, but we can't forget about the thing that makes it all possible.
Anesthesia.
Yeah. Anesthesia. I mean, it's amazing how we can make these potentially painful procedures tolerable.
It is incredible. Anesthesia is essentially a technique of using medications to block pain, and in some cases, to make the patient unconscious during the procedure.
Okay, so there are different types of anesthesia, right? Not every surgery requires the patient to be completely knocked out.
Right. You've got general anesthesia, which is when you're completely unconscious, and then regional anesthesia, which just numbs a specific area of your body.
Oh, okay. Like, what are some examples of that regional anesthesia? I know I've heard of epidurals, but I don't really know what they are.
An epidural is a type of regional anesthesia where they inject the anesthetic into the space around the spinal cord. It provides really good pain relief over a larger area, and it lasts for a long time, which makes it a good choice for labor and delivery.
Ah, that makes sense. So the type of anesthesia really depends on the procedure and the individual patient.
Yeah.
How do healthcare providers decide which type is best?
It's really a team decision, taking everything into account. The type of surgery, how long it's going to take, the patient's medical history, their preferences. The anesthesiologist or the CRNA, they're the experts in this area. They carefully assess each patient to develop an anesthesia plan that's tailored to their needs.
So it's not a one-size-fits-all approach. It's really personalized for each patient.
Absolutely. Now, speaking of patient-centered care, let's shift gears to a really important legal aspect of perioperative nursing.
Okay.
Informed consent.
Informed consent. That's all about making sure the patient fully understands what they're agreeing to.
Exactly. It's about ensuring the patient has all the information they need to make a truly informed decision about having surgery. They need to understand the risks, the benefits, what the potential alternatives are.
What role does the nurse play in this process? Are we the ones actually obtaining the consent?
No, that's actually the surgeon's responsibility. But nurses, we play a vital role in clarifying information, addressing any questions or concerns the patient may have. We're the patient's advocate in this situation.
Okay, so we're like a bridge between the surgeon and the patient, making sure the information's flowing clearly.
That's a great way to put it. Now let's talk about something that's near and dear to every nurse's heart: preventing complications.
Complications. I know they can happen even with the best of care, so being proactive is essential. What are some of those common postoperative complications nurses need to be watching out for?
Well, respiratory complications, those are always a big concern. Things like atelectasis and pneumonia. We've talked about deep breathing, coughing, incentive spirometry as ways to prevent those. But we also have to be really observant, looking for any signs of respiratory distress in our patients.
Right, those breathing exercises, they're so crucial, especially after abdominal or chest surgery. What about those blood clots, the DVTs?
DVTs are a major risk after surgery. And early ambulation, getting those patients up and moving as soon as it's safe, that's one of our best weapons against them. It helps to get blood flowing, and it prevents those clots from forming.
But sometimes getting patients up and moving is easier said than done, especially if they're in a lot of pain or feeling weak.
You're right, it can be challenging. We have to be creative, adapt to each patient's needs, maybe start with some simple exercises they can do in bed, like ankle pumps or leg lifts. And as they get stronger, we can gradually increase their activity level.
So we meet them where they're at and help them progress.
That's it, we're their cheerleaders. Now, another area we focus on is preventing surgical site infections. And of course, meticulous hand hygiene is absolutely paramount, both for us and for our patients.
Hand hygiene, it's so simple, but so important. What else can we do to prevent those infections?
Aseptic technique when we're doing dressing changes is crucial. Using sterile gloves, sterile dressings, sterile instruments.
Got it. So hand hygiene and aseptic technique, those are our infection-fighting power couple.
They are. And, we can't forget about those other essential functions, like going to the bathroom.
Oh, right, of course.
Surgery can really disrupt those normal bowel and bladder functions. So urinary retention, when the bladder isn't emptying properly, that's a common problem.
Yeah, I can see how that would happen with the pain medications and the decreased mobility after surgery. How do we help those patients?
We might use a bladder scanner to see how much urine is in the bladder. And if it's full, We might have to do a straight cath to drain it.
Okay. What about constipation? I imagine that's a pretty frequent complaint after surgery.
It is. We can encourage them to drink plenty of fluids, eat those high-fiber foods once they're able to tolerate them, and sometimes we might need to recommend stool softeners or laxatives to get things moving.
So many things to consider. It sounds like you're constantly having to put on your detective hat, looking for clues, and trying to anticipate potential problems.
It's true. We're always assessing, monitoring, and intervening to try to ensure our patients have the best possible recovery. And remember, communication is key throughout this whole process.
Communication. That's a recurring theme here, and for good reason. It's so important for coordinating care.
Absolutely. We're constantly communicating with our patients, their families, the surgeons, the anesthesia providers, everyone who's involved in their care. That's what allows us to work as a team.
It's a true team effort, and that clear communication is what holds everything together.
Well said. We've covered so much ground in this second part of our deep dive. From classifying surgical procedures, understanding anesthesia, tackling those postoperative complications, we're building a solid foundation of perioperative knowledge here.
We are. And for those of you listening who are eager to learn even more, stay tuned for the final part of our deep dive, where we'll wrap up our exploration of this amazing specialty. Welcome back to the deep dive. We're wrapping up our journey through the world of perioperative nursing. We've gone from those pre-op jitters through that crazy OR, and now we're in the post-op world.
It has been quite a ride, hasn't it? As we come to the end of our deep dive, let's shine a light on some key things that can really make a difference for our patients in their recovery.
Okay, I'm ready for those final pearls of wisdom. What do you have for us?
Let's talk about something that can really make or break a patient's recovery. Managing pain.
Oh yeah, pain management, that's huge.
Post-op pain is pretty much a given. But how we manage it has a huge impact on the patient's comfort, their mobility, even how well they heal.
You're right. If their pain isn't managed well, those first few days after surgery can be awful.
Absolutely. And it's important to remember that pain is subjective. What one person can handle might be unbearable for someone else.
Right. Everyone's different.
Exactly. So we can't just rely on a pain scale.
Yeah. You have to look at the whole picture, what the patient's telling you, their vital signs, how they're behaving.
You got it. So we really tailor our pain management strategies to each individual patient. We use a multimodal approach.
Multimodal, yeah.
Meaning we use a combination of things. Medications, non-pharmacological techniques, or both.
Non-pharmacological, so like repositioning, ice packs, distraction.
Exactly. Those things can be really effective, especially when we use them along with medications. And sometimes, just providing a calm, supportive presence can make a world of difference.
It's all about that holistic approach we keep talking about.
It is.
Okay, so let's talk meds. What are some of the go-to pain relievers for post-op patients?
Well, opioids are often necessary, especially for moderate to severe pain. But we always use them carefully because they can have side effects.
Right, like respiratory depression.
Exactly, or constipation.
Yeah, so we have to be mindful of those things.
We do. We might also use NSAIDs, those non-steroidal anti-inflammatory drugs, for milder pain. And sometimes we use nerve blocks or epidurals to provide more targeted pain relief.
Okay, so there are a lot of different options.
There are.
It sounds like pain management is a bit of an art, isn't it?
It is, finding that perfect balance for each patient. And it doesn't stop there. We're constantly reassessing and adjusting our strategies based on how the patient's responding.
It's an ongoing process.
It is.
It makes sense.
Yeah.
Okay, let's move on to another common challenge after surgery. Nausea and vomiting.
Ugh, yes. PONV, nobody likes that.
I can imagine. It can really set a patient back in their recovery.
Absolutely. It delays healing, it can lead to dehydration, and it increases their risk of aspiration.
Right, aspiration. That's when vomit gets into the lungs. That's scary.
It can be very serious. So
Right.
we try to minimize the risk as much as possible. We have a few different strategies.
Okay, like what?
Well, we can give antiemetic medications. Those help prevent nausea and vomiting.
Antiemetics, those are lifesavers.
They are, and we encourage our patients to eat small, frequent meals, stay hydrated, avoid strong smells, and getting them up and moving as soon as it's safe can really help too.
Movement is medicine, right?
It really is. But even with all of that, sometimes patients still experience nausea and vomiting.
Okay, so what do we do then?
We provide supportive care. Keep them cool and comfortable, offer them small sips of clear liquids, and of course we give those antiemetics as ordered, and we monitor for any signs of dehydration.
Okay, makes sense. So you're addressing the symptoms and making sure they're not getting dehydrated. But what about the emotional side of things? I mean, it can be really upsetting to be nauseous and thrown up on top of everything else you're going through.
Absolutely. So that's where our therapeutic communication skills come in, just listening to them, offering reassurance, letting them know we understand how they're feeling. Those things can make a big difference.
Right. It's all about treating the whole person. Now, before we wrap things up, let's talk about one more essential piece of the postoperative puzzle: patient education.
Oh, yes. Empowering our patients to be involved in their own recovery, that's one of the most important things we do.
Absolutely. What kind of information do they need before they head home?
Well, first and foremost, we need to make sure they understand their discharge instructions completely. That includes things like what medications they need to take, any activity restrictions they have, how to take care of their wound, any dietary changes they need to make, and when to call the doctor if they have any concerns.
Wow, that's a lot to remember, especially when they're still recovering from surgery. How can we be sure they really understand all of that?
The teach-back method is really helpful. We basically ask them to explain it back to us in their own words. That way, we can catch any gaps in their understanding.
It's like that saying, tell me and I forget, teach me and I may remember, involve me and I learn.
Exactly. We want them to be active participants in their recovery, not just passive recipients of information.
Well, we've reached the end of our deep dive into perioperative nursing. It's been an incredible journey learning about all the facets of this dynamic specialty.
It has been. From those initial pre-op assessments to the intricate world of the OR and into the delicate balance of post-op care, we've explored it all.
We've talked about advocating for patient safety, mastering those essential skills like sterile technique and pain management, and so much more.
And as you move forward in your nursing careers, remember that learning never stops. Stay curious, embrace new challenges, and always be your patient's champion.
That's a great note to end on, and that's a wrap on the deep dive. Until next time, keep those nursing brains buzzing and those compassionate hearts shining.